This was frightening to me. Now, I looked at it and said, well, wait a second. How did Canada get to this system of Obamacare? How did Canada get to this place where you only had one place to go, and that was the government? It wasn't born with nationalized health care. How did they get there? Well, there was an intermediary step that happened late 70s and early 80s, and it was very much like what we are facing now with Obamacare. It was government putting a gun to your head saying, whether you want to or not, you will purchase this private policy. And if you don't buy it, we will force you to buy it, or we'll tax somebody else and give it to you. That morphed to where they're going. This is why a mandate for health care, I believe, is wrong on two levels. One, I find it to be completely immoral that the government would force us to buy a product just because we happen to breathe. Secondly, when you look at what happened in Canada, when you look at what happened with Massachusetts' version of Obamacare, call it Romneycare, a mandate, you see how that's happened. I think that's one of the reasons that you saw such a wonderful revolt over Kennedy's old seat. I want to bring back to something a bit more personal. Years back, my wife and I ended up having a family rather late. Mostly because I was just scared to death of being a father, and if you know me, you know why. And when she was pregnant, I had one simple request of her. It wasn't this hard. I said, give me a boy. That's it. Just give me a boy. You know, don't have to be a smart boy. Just give me a boy. I know boy stuff. I'm good with things. I can teach him how to belch the alphabet. I can teach him how to fail at hitting on women in bars. I can teach him the all-important, glorious pull my finger routine. These are the skills that I have, and I want to impart to the next generation. And I made it clear. This is something you will do. It's a pretty simple thing. And then the big day came, and it was, and if you've ever been in the room, it's a pretty amazing and petrifying thing to see a human come into the world. And out he came, and he was all in this little bundle, and he was squished up with his arms and legs, and one arm popped open like a petal of a flower, and then the other arm, and a leg, and another leg. And I looked at him, and I said, it's a boy, and what a boy. And the doctor said, no, that's the umbilical cord. that Mr. Caldara is a girl. And I was rather deflated. And you can imagine, and my wife was holding this thing, and she looked up at me with those, those eyes, and she said, you still like her, don't you? Now, I'm slow, but I know occasionally when to give the right answer. And, oh, of course, I like her. Back in my mind, I'm panicking. I got nothing to offer this person. I got no skills to offer this person. And so it goes for a few months. I see my wife strangely attached to this thing, and I don't quite get it. And then, and I think many of the fathers here understand this, this creature looked up at me one day with this look of, I've seen you before. You're that idiot that hangs around my mother, aren't you? And it was that thing of, she recognized me. And then she did this stupid thing. She held my finger. And, oh my God. I don't know why anybody ever wants a boy. Boys are disgusting, hideous creatures. They smell bad. They break things. They're awful. Girls, however, girls give you romance. It's like having this great romantic affair, and your wife is happy for you. It's perfect. It's incredible. And Parker did something that was just amazing. She took away and melted my fears of being a father, and gave me the excitement. And I thought I knew love until I knew Parker, and then I really knew what it was all about. And I would always get so upset if she got hurt and she cried and all the usual freak things. When she started throwing up one day, it's like, oh my God, what are we doing? And all the other parents are like, relax. Kids throw up. And she kept throwing up for a couple days. She was almost a year old. And she kept throwing up. We brought her to the doctor. She said, nah, it's a virus, it's going around. Let's just wait another day. She kept throwing up. We brought her back, and they said, I tell you what, she's fine, but she's got to go through this. Let's bring her to the hospital and give her an IV so she doesn't get dehydrated. We didn't have to wait 3 months to get a hospital bed. She got a hospital bed like that. She got the IV. The next day she was still vomiting. Doctor said, well, let's just check out something. Well, let's just do a quick test. I want to rule something out. And they did a quick CAT scan on her. Went up a flight of stairs. We didn't have to wait. It happened. A little later, the doctor walked into the room and informed us that my daughter had a brain tumor. That tumor was sizable. Within a half an hour, we were in an ambulance on the way down to Children's Hospital, where the very next day, she was given an MRI. She didn't have to wait 8 months. She didn't have to wait a year. The MRI showed that it was cancer. It had metastasized into her spine. We didn't know what to do. They said, well, we need to biopsy it. We didn't wait 4 months. We waited a day. They did surgery, put in a shunt to drain the fluid. They took a biopsy. They looked at it, and it turned out to be a very rare, very vicious, and always fatal form of cancer. They couldn't save my daughter. And I'll tell you that you might have been scared sometimes, but you do not know what fear is until you hold your only child, knowing she will die, and there's no amount of money, power, or wealth that can stop that. We brought her home. She actually died within about 12 hours in my little house. You know, when you're a parent and you go out and you have all that crap on you and your diaper bag and the stroller and this, and you hate it, you hate it, you hate it. If I could express to you what it feels like to walk out of your house and not have any of that on you for the first time, and no child. It was the most unsettling, awful thing. And our job was to go and pick a cemetery plot. This was not what I expected.